advanced clinical biochemistry and molecular diagnostics subject, and we already completed Zollinger-Ellison syndrome. So we already completed this one in the previous class. So that is lecture 3 is over, and celiac disease also completed, and all the serological tests for celiac disease and lactose intolerance also, and oral lactose tolerance test is also conducted. Okay, maybe for the confirmation of lactose intolerance. Okay, this is also completed, and this is a normal reference level. So today's class, okay, we are going to deal with pancreas. Okay, so today's lecture we are going to start with pancreas, and we are going to deal only with the pancreatic function. Okay, that is exocrine function of the pancreas. So there are two different functions of pancreatic function. Okay, that is exocrine and endocrine. You already know that the pancreas is an organ involved in the functioning of so do different role. Okay, that is endocrine, so secretion of hormones. So what are the hormones secreted by pancreas? So these two very important hormones, the insulin and glucagon. Okay, these two secreted by the pancreatic islets, the beta cells of pancreas and alpha cells of pancreatic islets produce both. Beta cells will produce insulin and alpha cells will produce glucagon. So these two roles, okay, you are going to study in the separate subject. Okay, that is endocrinology, and we are going to study about the exocrine function, the secretory function. So the pancreatic function is very important. Without pancreas, okay, there is no life, because these two hormones may play a very important role, okay, to control the glucose homeostasis, because the maintenance of the normal glucose level in the body. Okay, both insulin and the glucagon. Apart from that, okay, we have one more function, that is exocrine function. So that is secretory function. The major exocrine functions of the pancreas are production and the secretion of pancreatic juice. So this one is very important. So pancreatic juice is nearly a normal subject, normal person, a 70 kilo man, he can secrete approximately 3000 ml, that is 3 liters of pancreatic juice, okay, on a 24-hour basis. Okay, so this is rich in digestive enzymes and bicarbonate. So not only the digestive enzymes to digest, and it is having the bicarbonate salt, okay, to neutralize the acid secreted by the stomach secretion. Okay, so the major exocrine function of the pancreas is the production and the secretion of pancreatic juice, and that is rich in digestive enzyme to facilitate digestion, and the second one is bicarbonate ion. And next one is the properties of pancreatic juice. Okay, that is the colorless and odorless, and the pH is 8 to 8.3. So do you have any disturbance in the audio?
No, sir.
No. Okay, right.
No, sir. No, sir.
Okay, right. Next one is the properties of pancreatic juice. So it is colorless. So there is no color. It is colorless. It is like a water. So watery substance, and it is odorless also. There is no odor. There is no smell at all. If you check the pH, okay, the pH, it is around 8 to 8.3. It is in the alkaline pH. So this due to this alkaline pH, so this pancreatic juice will neutralize the acid secreted by the stomach. So the pancreatic juice is going to join in the duodenum area, and after that, okay, this the pH is maintained, okay, by the neutral pH. So before that, most probably, okay, the acidic pH. The total volume secreted in 24 hours, okay, in a normal subject, okay, this is normal adult, approximately 70 kilo man, okay, is equal to 3000 ml. The enzymes secreted in pancreatic juice are trypsin, amylase, lipase, chymotrypsin, and elastase. So all these are present in the pancreatic juice. Just imagine trypsin, amylase, lipase, chymotrypsin, and elastase. All these enzymes are very important. You already know that, okay, maybe the trypsin and chymotrypsin is an enzyme and a zymogen is produced, okay, before that. Okay, that is at the time of secretion. So within the pancreatic juice having chymotrypsin, okay, and this chymotrypsinogen, okay, and trypsinogen, and this one, if it is released into the duodenum, only in the duodenum, so due to the action of the proteolytic activity, so this trypsinogen is converted into trypsin, and chymotrypsinogen is converted into chymotrypsin. So chymotrypsinogen is not active, and trypsinogen is also not active, and both are converted into active form only in the duodenum. Okay, and one more enzyme, okay, these two enzymes, okay, for example, the trypsin and chymotrypsin are proteolytic enzymes, and amylase is amylolytic, okay, that means saccharolytic enzyme. Okay, you know that, okay, the carbohydrate cleaving enzyme, and lipase means a lipid degrading enzyme. And next one is elastase is enzyme not involved in the digestion process, okay, the partially involved, okay, some of the muscle tissues, okay, can be digested, okay, by the elastase, but it is not a major function. We can have a YouTube video, okay, about what is pancreas, and what is the role of pancreas, and what is the maybe the physiology of pancreas and everything. So we can have a look. I think the audio will not be clear, but I will give the explanation, okay, for this.
Chronic pancreatitis. Chronic pancreatitis is caused by long-term inflammation of the
So this is pancreas. So this area is the pancreas, and you can see here normal pancreas is inside, and this is inflamed pancreas. That means, so due to the infection, or otherwise, okay, due to the the work, or otherwise maybe some inflammation due to some accumulation of toxic substances, okay, this may be enlarged into, okay, this size. Okay, this is inflamed pancreas, and this one is the small intestine, okay, to this small intestine, and there is a region, okay, the bent region is, this is called as a duodenum. So some of the transparent areas are shown here, that is so this is your stomach, and this is liver part, and this is esophagus, and this esophagus maybe transport all of your food stuff, okay, into the stomach, and stomach will secrete all the acids for the digestion, and maybe after the complete digestion process of the stomach, and this will expel due to the peristaltic movement, okay, this will expel the food stuff into this area. You can see here there is a duct here, okay, this is a duct, okay, this duct is getting the secretion of both this is the bile, this is called as gallbladder, and this secretion of canaliculi of the liver, and all the secretions are stored here, and only at the time of digestion, okay, this gallbladder will compress and secretes, okay, the bile into this. So this green color indicates the bile duct, okay, and this one, okay, this is, so this one is also the secretion from the pancreas. So both pancreatic secretion and also the bile duct are going to join in this area. So then it is a common duct. So this duct will open, okay, in the duodenum area. You can see here, okay, the normal size is like this. So the inside, okay, this is the normal size, and the outside one, maybe the rugged surface, okay, that was shown here, okay, there is you know, the scarring of tissue, okay, may happen, okay, for the pancreatic tissue. So pancreas is a very important organ, okay, next to liver, because that is having, okay, both exocrine and endocrine function, okay.
pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case.
No, it is already given here. The pancreatitis is chronic pancreatitis is enlargement of pancreas, and destruction of pancreatic tissue also, may happen, okay, in this. So what are the reasons for this? So why the pancreas is inflamed and why it is more scarry? Scarry means, okay, the tissue is more rough surface and it is having, okay, lot of complication, okay, due to that. And the main thing is, okay, long term heavy smoking. Okay, this smoking may kill, okay, some of the tissues of Langerhans and also the secretory function tissues also. And lifestyle factors, okay, in the predisposed patients, long standing heavy alcohol use. If the alcohol content is, okay, maybe 35 ml to maximum 75 ml per day, okay, for a 70 kilo man. Okay, just imagine, okay, if it is a 45 kilo women, okay, what is the level? So 75 divided by 2. So that means, okay, maximum 30 ml capacity of 40% alcohol can be consumed per day. So this will not harm your tissues. At the same time, okay, if it is exceeded, okay, don't think, okay, taking the red wine, maybe 1 liters of red wine or otherwise taking beer is good for health. Not like that. So anything with alcohol is toxic to liver and also pancreas. Okay, this is the main reason, and we can see one by one. Okay, what are the causes of pancreatic chronic pancreatitis?
Is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis.
You can see here, okay, other complications which may trigger chronic pancreatitis, that is medications. A person taking medication for diabetes mellitus, and he is like, okay, the squeezing of the beta cells of pancreas, okay, to secrete insulin, or otherwise maybe making, okay, the secretion exocrine function, okay, that means digestive syrups, and also some of the drugs, okay, like for the digestion processes, okay, like steroids, okay, may involve, okay, in this also. Elevated triglyceride levels, for example, okay, a person is taking, okay, a lot of amount of maybe more fatty rich meal, fatty acid rich meal, or other fat rich meal. So this will again elevate the levels of triglycerides in the body. At the same time, okay, this one will create lot of complications in the normal functioning of the pancreas. And next one is autoimmune disorder. A person, okay, may have some of the autoimmune capacity, okay, due to hereditary also. So this one will create lot of complications. The antibodies are secreted towards the pancreas. So this will bind to the pancreatic tissue and induces okay, the macrophages and the inflammation also. Okay, due to that, the normal smooth skin of the pancreas is converted into a scarry tissue, and also the inflammation, due to inflammation, the bulging of pancreas may happen. So it is called as pancreatitis. Okay, the disturbance, okay, to the normal function of pancreas. So this is inherited or genetic conditions like cystic fibrosis and hereditary pancreatitis. So this is related to gene, and if the person is getting this type of genes, okay, due to hereditary from mother or father, okay, they may develop, okay, all these complications. Okay.
In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes to break down food in the digestive tract.
So just now, okay, we had a discussion.
When the
So
in the digestive tract.
this one is the endocrine function, insulin, glucagon, and somatostatin, and the pancreatic polypeptides, and these are all the conditions related to endocrine function. Produces hormones that regulate the blood sugar. Exocrine function is amylase, protease, and lipase. So all these digestive enzymes are secreted. Okay, right.
When the pancreas doesn't work properly, it affects the body's ability to properly digest food. This means that some people with chronic pancreatitis are unable to get the nutrients they need from the food they eat. They can have trouble digesting food properly or maintaining their blood sugar in a healthy range. This can lead to nutrition-related disease such as weak bones and vision loss. Some people may also have difficulty gaining or maintaining their weight and persistent pain. The hallmark symptom of chronic pancreatitis is abdominal pain. The pain may be intermittent or chronic and is frequently very severe, with stabbing pains localized in the upper part of the abdomen between the belly button and the chest. The pain may radiate to the back and may be triggered by eating, especially high-fat foods. As the disease progresses, the pain may become more severe and debilitating, and often it becomes constant.
So the main signs and symptoms of pancreatitis, the main symptom is abdominal pain, and so this pain may increase day by day, okay, due to the chronicity of the pancreatitis, and sometimes, okay, this may create intolerable pain, and this may radiate the pain to the backside, okay, and this may give some wrong maybe the input, okay, for the persons, the doctors, okay, to diagnose, okay, the physical diagnosis, because so the area that is going to give the pain signal, okay, that is nearby to the kidney, okay, they will think, okay, this may be the kidney stone or something. So this is more complicated one. The signs and symptoms are more or less related to the signs and symptoms of ulcer, and the signs and symptoms of the very chronic one, the back pain, okay, that is more similar to the kidney stone also. So very difficult to identify, and this needs some endoscopic treatment, okay, that is the endoscopic study first of all. So this one we can see one by one.
In some cases, surgery or endoscopic treatment may be required. Oily, foul-smelling bowel movements and weight loss may be seen in the advanced stages of the disease, and usually signals exocrine pancreatic insufficiency. As well, depending on the severity and extent of the damage to the pancreas, some people develop diabetes.
The main thing is one of the main complication of chronic pancreatitis is the disease diabetes. Okay, this may be if the cells of beta cells are affected, that may create the complication. Okay, that is very famous, is known as, okay, type 1 diabetes mellitus, and without that one, maybe the insulin levels are normal, but the glucose homeostasis, okay, may not be there, okay, that is called as type 2 diabetes mellitus. Another very common symptom is the weight loss, okay, the weight loss, okay, due to the fat improper digestion. That means the fat is excreted as such, the oily and full smelled stool. Okay, it's called as steatorrhea. Steatorrhea means the oily stools. Okay, these are the main common symptoms. Based on the question asked to the target group, the patients, the doctors, they can come to the conclusion whether they have the chronic hepatitis or not. Sorry, chronic pancreatitis or not. Okay, because this is maybe quite confusing with the ulcer and also the kidney disorders. Okay, and same with the complications. And once again,
as well, depending on the severity and extent of the damage to the pancreas, some people develop diabetes. A combination of tests are used to diagnose chronic pancreatitis. In some people, diagnosis is challenging due to the course of the disease. However, in others, it is relatively straightforward. A CT scan of the abdomen is the most commonly used.
The first one is the CT scan of the abdomen. Okay, that means so this is more expensive, and when compared to the endoscopy and all, endoscopy is approximately 1,800 rupees or 2,000 rupees, and this may be 3,500 rupees or 4,000 rupees. It depends on the hospital or the lab, and so based on that we can come to the idea. We can conclude, okay, whether this pancreas is functioning or not, and pancreatitis is there or not, and what is the stage of pancreatitis. And the CT scan of the abdomen is most commonly used to test, okay, for the chronic pancreatitis. It is not a first line, so maybe the first line may be the diagnostic test like the ultrasonography, then the clinical test and everything, and this may be the confirmatory
test. An MRI or endoscopic ultrasound may also be used to confirm the diagnosis. In some difficult to diagnose cases, pancreatic stimulation testing can be useful. This test artificially stimulates the
So this is our job. So in the clinical diagnostic test, okay, if the doctor is prescribing a test to you, And if you want to do the testing, the main common test is the pancreatic stimulation testing, and they will insert a substance. It's called a secretin. So this secretin can be inserted, okay, into the endoscopic tube, and this is secreted or otherwise exposed to the area of that is duodenum. So till the duodenum they will insert the tube, and so near the duodenum, okay, they will release the substance, okay, secretin. You can see, okay, what is going to happen.
Pancreas using secretin. This test is expensive and invasive, so it is not frequently performed. Blood tests are not useful for diagnosing chronic pancreatitis. Although there is no cure for chronic pancreatitis, early diagnosis and treatment can help slow the progression of the disease. Treatment involves avoiding triggers, such as heavy alcohol use, smoking, and high-fat foods.
Yeah, these are all the recommendations, okay, by the doctors, okay, to the patients of chronic pancreatitis. One is no alcohol. The alcohol should be stopped completely. So you should not say that, okay, I'm taking only 20 ml or 30 ml, not like that, okay. You have to stop it completely, and a person should be advised to not to take alcohol, not even a drop. And the quitting of smoking. So here there is no reduction of smoking, quitting of smoking, and avoid high fat food. So they are advised to take the normal diet, okay, especially, okay, the more vegetables or fruits, okay, like maybe without any fried food or otherwise no oily foods like, okay, the puri and all, okay. So this avoiding of high fat food, okay, that is the good recommendation by the doctors. And the pain management, okay, if the pain is persistent and also it may be spreading to the backside of the body, okay, they will give some painkillers also. This medication is they will give some medication, okay, like antacids, and sometime, okay, if you're not able to digest the lipid, and due to that, okay, if you have more diarrhea or something means, okay, they will give the medication for that. And the multivitamin and the mineral supplements, because due to the digestive problem, because you are not able to digest so the fat, and okay, normal metabolism is not achieved, so that means you're all deficient of mostly all the vitamins and the minerals. So the fat rich the food, okay, without digestion it will go into the small intestine, and that will stop, okay, all the mineral and also the multivitamin absorption also. Okay, usually, okay, there in the small intestine, large intestine, the fat content is very less, and if it is very less only, all the vitamins and all the mineral supplements can be easily absorbed by the small intestine. If the fat is there, mostly the vitamins, for example, okay, you already studied, okay, the A and the K vitamin and E vitamin also. So all the three are fat soluble. Okay, just imagine, okay, all the fat soluble vitamins will be mixed with the fat available in your small intestine. So it will not be transport or otherwise okay, the completely absorbed by the small intestine. So this may be the problem. Okay, we have to take the supplements.
Other treatment interventions involve pain management, medication such as pancreas enzyme replacement therapy, PERT, and supporting a healthy diet with multivitamin and mineral supplements.
Yeah, so with that, maybe you can have an idea. So what is pancreas and what is the secretion of pancreas, both endocrine and exocrine function of pancreas, and maybe what are the chronicity of the chronic pancreatitis, and how we can diagnose, and maybe what is the scope of the clinical biochemistry persons, okay, in the clinical lab to diagnose. For the initial stages, maybe the scope of diagnosis may be possible for the clinical biochemistry persons, because if it is more, maybe if it is in the acute stage, no problem. If it is in the chronic stage, okay, maybe the diagnostic tests are not useful, because it is clearly evident that, okay, most of the complications like the pain in the stomach, and especially in the area of pancreas, and so all the symptoms, okay, clearly evident that, okay, that is pancreatitis. So no need to go for, okay, the basic test and all. So I'm going to teach you, okay, these are the diagnostic tests for exocrine functions of pancreas. The number one is invasive and the number two is non-invasive test. The number one invasive test is the measurement of total volume of pancreatic juice. Okay, and the second one is determination of amount of concentration of bicarbonate, and third one is the determination of activities of pancreatic enzymes. So all the three comes under invasive test. You already explained, okay, what is the meaning of invasive test. Invasive test means just we have to insert a probe like, okay, tube, okay, that's called as endoscopy. So this is done by a doctor, okay, and not by the ordinary persons and all, okay, and they will give some anesthesia, okay, to the mouth and especially in the throat, and they will insert a small tube, okay, inside, and okay, the small tube is having the fiber optic system and they can see the parts, inner parts. So that is one advantage. And if they want to insert something, okay, they can insert, okay, they may inject some part, okay, into that, and if they want to take some sample also, they can take it. So here the secretin, so they are going to inject secretin, okay, either in the bloodstream or otherwise, okay, nearby to the tissues of the pancreas, okay, for the immediate delivery, okay, to the pancreas tissue. So the best one is, okay, by giving the intravenous administration of secretin, and if somebody is allergic to that, okay, they will give it to nearby areas, okay, by the pricking test, and also a small amount of secretin is injected, okay, into the duodenum area. And so this one will induce the pancreatic function, okay, that is why the pancreas will secrete much and finally gives the pancreatic juice. The measurement of total volume of pancreatic juice, for example, the patient is admitted in the hospital, and the morning, okay, they will insert the tube, and they will insert a tube, okay, into the port of the pancreatic duct, okay, there, okay, they will maybe they fix a tube. So that tube automatically collect each and every day how many amount, how much amount of how many ml of the pancreatic juice secreted in 24 hours. So normally I said, okay, just now I said, okay, maybe 3000 ml is the normal range of the pancreatic juice secretion for a 70 kilo man. So this may depend on the person, maybe diabetic, that may be reduced, and if they have some complication like cancer, okay, that may be reduced, and these are all the complications. If it is 3000 or 3000 range, like 2800 ml, also no problem. And that is the one. The first one is measurement of total volume of pancreatic juice. Second one is the determination of amount of concentration of bicarbonate. How much amount of bicarbonate is present, okay, in the pancreatic juice secretion. For example, the pancreatic juice is secreted if it is more diluted, okay, and the bicarbonate ions are very, very less. So that means what will happen, because the stomach is producing acid, and if it comes to the duodenum, this has to be neutralized by the bicarbonate ions. If the bicarbonate content, the concentration is less, means the acid, the part, okay, that cannot be neutralized by the bicarbonate ion. So that leads to, okay, more acidic pH, okay, in the small intestine food, and also, okay, that increases the possibility of getting the ulceration in the small intestine and also the duodenal ulcer. Okay. Number 3 is the determination of activities of pancreatic enzyme. So we can collect the pancreatic juice, okay, it's online, then we can collect the sample, and that may be given to the clinical biochemistry lab, okay, to check the pancreatic enzymes are active or not, okay, whether they are in the active condition. Okay, if the enzyme is produced, but if the enzymes are not active, what is the use? Nothing. So the person cannot able to digest the food. So the pancreatic enzymes has to be tested for their activity, enzyme activity, and maybe from the aspirations. So here all the enzyme activity and bicarbonate output and bicarbonate and enzyme, so can be studied only with the help of an inducer. Inducer means a stimulant. Usually in the clinical lab, the secretin is used, okay, for the diagnosis of the pancreatic function, okay, using the invasive test, because secretin is it is a substance, okay, that will induce the function of pancreas. Okay, the secretin, without secretin, the pancreas will not secrete the pancreatic juice. Okay, that is the indicator. Okay, so the first test is a Luth test. Here the standardized meal, okay, given, and they will check the total amount of enzyme produced, and the total amount of enzyme output is also there. Okay, that is also checked. Okay, is analyzed. Number 2 is secretin stimulation test. In the secretin stimulation test is there, that is a purified or a synthetic porcine secretin, okay, can be given, and based on that the bicarbonate output can be studied. So here, so this is not secretion, secretin, okay, this is porcine secretin. What is porcine? Porcine is pig, okay, from pig the secretin is purified and that can be given to the persons. So now this is purified form or a synthetic form, okay, can be used, okay, both can be. And the third one is very famous, secretin cholecystokinin test, CCK. So here the secretin with the cholecystokinin analog, or otherwise exactly the cholecystokinin can be used. The cholecystokinin is very expensive, and compared to that, okay, the analog of cholecystokinin, that is synthetic one, okay, that is more famous, that is called as cerulitide. So the cerulitide with secretin can be given to the persons, okay, to induce secretions of pancreatic juice, and based on that the bicarbonate ions and enzymes can be completely thoroughly checked. Okay, so that's all about invasive test of pancreatic function. And now coming to the second segment of pancreatic test, okay, that is non-invasive test of pancreas. Non-invasive means, okay, we are not going to use the endoscopy and all, just we are going to take the sample by using the normal the routine, the biochemical testing. Okay, the first test is the fluorescein dilaurate test. So this is mainly to check the lipase enzyme activity. It's very simple, the fluorescein dilaurate. So here the name of the substrate is the fluorescein dilaurate. So this one is very simple, that okay, the fluorescein is a fluorescent substance, dilaurate is a fatty acid. A fatty acid attached to a substance, a fluorescent substance. Okay, so this substance can be given to the patient, okay, by oral administration, that is the fluorescein dilaurate. The 0.5 millimolar concentration is the normal level. Okay, this is oral administration. That means we have to advise the persons to take, okay, this one 0.5 millimolar concentration of fluorescein dilaurate. There is no taste of, okay, that one. They have to drink it, okay, like water. And after that you have to rinse the tube or tumbler, okay, given with the fluorescein dilaurate, because we should not miss any concentration. And after that ensure adequate fluid intake, because the patient is advised to take, okay, more amount of liquid, because the clearance is more. Okay, if the water is less, and maybe, okay, the testing period may be the summer, so most of the water is evaporated, okay, as a sweat. So we have to ensure that, okay, the patient has to drink more amount of water. Okay, and we have to collect the urine for 10 hours. We have to advise the patients to be there in the hospital, or otherwise we can give some sterile can to them, when they have to collect, okay, all the sample of the urine for 10 hours without any contamination in their home, or otherwise in the hospital. The measurement of the fluorescein excreted, okay, in the urine, that means so we are collecting the urine from the patients either in the hospital or otherwise from the home only. The sterile sample of the urine has to be processed for the determination of the fluorescein substance. So why the fluorescein is liberated here? Because I said, okay, this dilaurate is a fatty acid. This dilaurate attached with the fluorescein. If the normal function of pancreas is there, means the pancreas will produce pancreatic lipase enzyme. So this lipase will act on the fluorescein dilaurate and liberates dilaurate, and the fluorescein molecule is also liberated. The fluorescein having the capacity, that is the fluorescence property, and we can analyze the fluorescence intensity, okay, by using the fluorimeter. And the day 2, the second day, and we have to tell the patient to come to the hospital or diagnostic lab, and they have to come with their maybe the cans, okay, if they are doing the collection of urine, okay, at their home. Next one is the second day, oral administration of fluorescein molecule. So we have to administer the fluorescein, okay, as such. So first day we administered orally the fluorescein dilaurate. Now we are administering fluorescein substance. The fluorescein is a chemical substance that can be given to the patients, that is also dose dependent. The dose is actually 0.5 millimolar, same concentration of fluorescein dilaurate also. and follow the steps, okay, the B, C, D, okay, in the day 1. B is ensure adequate fluid intake. Number C is the collect urine for 10 hours and measure amount of fluorescein excreted. So what is the first one? The day 1 is we gave the fluorescein dilaurate. So that is a test 1. Test means we have in the experiment we have the blank, control and test. The blank means, okay, without any the substance, okay, that is called as only the reagent is blank. And the second one is the control. Control means with enzyme or without enzyme, okay, that is also control. Third one is the test 1. Test means that is a testing, okay, the pattern is there. So the first day is test, second day is control. So based on the difference, okay, we can arrive the normal values of the standard or reference values of the pancreatic function. So we can go to the formula. The formula for the calculation is the fluorescein excreted on day 1. The first day, how much amount of fluorescein liberated, okay, in the 10 hours of sample. If you are collecting the 10 hours of sample in the can, sterile can, you have to mix it properly and without any frothing. So then you have to add, okay, the reagents, and we have to check, okay, the intensity of the fluorescence. So this may be possible in the lab. The fluorescein excreted on day 1 has to be calculated by using the fluorimeter, and the fluorescein excreted on day 2. So that is fluorescein excreted day 1 divided by fluorescein excreted on day 2. Okay, this is the value, and this is multiplied by 100. So this one is a value. Okay, this will give the test divided by control of the index. Okay, this one is very important. This formula, don't forget, the fluorescein excreted on day 1, that is the test 1 divided by control. Control is only the fluorescein excreted on day 2, because on day 2 we gave only the fluorescein, not the fluorescein dilaurate. Okay, multiplied by 100 and is equal to test divided by control, and this is the index, T by C index. So that is the value. The T by C index is a value that is very important for the identification of the status of the pancreas. Okay, you can see in the next section, okay, that is reference or standard values. So these reference or standard values are very important. You have to remember, okay, all these points, and this one is the normal pancreatic function is equal to T by C index. In the T by C index, it is approximately 30. Okay, 30 and okay, around 30. Okay, if it is there, means normal one. If it is lesser than 30, there is a minimum level is there. That is the minimum reference level, the maximum reference level. Okay, that is the lower reference level and upper reference level. So this is the upper level is okay, the 30 and above, and lower reference level may be 20. In the pancreatic insufficiency, the T by C index is approximately 20. If it is 20 and below, so 20 and below, okay, that indicates the pancreatic insufficiency. So this one is very important. 30 till 30 to 20, maybe 22 or something is okay, but 20 is a border. Border means okay, this the pancreatic function is not normal or not abnormal. Okay, we cannot come to the conclusion about that one. Okay. So the pancreatic insufficiency clearly depicts that okay, the TC index is the 20%, 20% or below 20%. No problem. Okay. By this we can come to the conclusion whether the pancreas is working or not, or due to the inflammation or pancreatitis, acute or chronic pancreatitis, the pancreatic function is limited, and due to the limitation of pancreas, the secretion of pancreatic juices, so that is with pancreatic enzymes will act on the food okay, in a lesser concentration, and there is very less amount of digestion is also there. So these are the complications arising day by day, okay, due to pancreas. So the prognosis also, this may be very useful, the non-invasive test of pancreas. So this is a very important question on the examination point of view, the non-invasive test of pancreas, the fluorescein dilaurate test. Okay, I hope okay, you understand okay, this concept, and don't forget to remember the formula and also the reference values. Next, coming to the second test, the PABA, para-aminobenzoic acid. The abbreviation of the PABA is para-aminobenzoic acid. So here the PABA, the para-aminobenzoic acid is the substance, okay, is a molecule, can be easily identified, okay, by using colorimetry. So initially I told the fluorescein dilaurate. If you have the fluorimetry, you can use that the fluorescein dilaurate method, and you can give the sample to the patients. Unfortunately, you are in the small city or otherwise in the small town with a small clinical lab. Maybe you can have some the colorimeter or otherwise spectrophotometer, okay, in the visible region also. In this case, okay, we have the alternative, okay, that is benzoyl tyrosyl para-aminobenzoic acid. So the benzoyl tyrosyl para-aminobenzoic acid means para-aminobenzoic acid is the testing substance. So that can be combined with the benzyl tyrosyl. Benzyl tyrosyl is amino acid moiety, so that is attached with the para-aminobenzoic acid. So here we are going to evaluate the function of the pancreas, okay, by means of the protein hydrolyzing enzymes. So what are the protein hydrolyzing enzymes of the pancreatic juice? We have trypsin and chymotrypsin. So initially the first test, okay, this one is the test using the enzyme lipase function. Okay, the second one is the PABA test, okay, using the activity of proteolytic enzyme, okay, that is trypsin or chymotrypsin. So here the same thing, okay, the oral administration of the benzoyl tyrosyl para-aminobenzoic acid, the same concentration like the fluorescein dilaurate, the 0.5 millimolar, including all the tests are similar. You can see here the day 1, this is the day 1, day 2, and here the day 1, day 2, both are same. Only difference is the benzoyl tyrosyl para-aminobenzoic acid, okay. And this one maybe this is the only difference, benzoyl tyrosyl para-aminobenzoic acid, and here, okay, this one is fluorescein dilaurate, including the concentration is same, okay. Ensure adequate fluid intake, collect urine for 10 hours and measure the amount of PABA, okay, that is para-aminobenzoic acid excreted, okay, in the 10 hours of urine. Mix the urine sample completely and take an aliquot and check how much amount of para-aminobenzoic acid, okay, by colorimetric estimation or otherwise by using the spectrophotometric determination. If you have spectrophotometer, you can use fix the nanometer and check it, or if you have colorimeter, maybe that is more than enough, okay, to check the concentration of PABA. And day 2, you can give only the PABA, the same concentration, that is the 0.5 millimolar concentration, okay, to the patient, and follow the other steps of B, C, D on the previous day 1. So that is ensure adequate fluid intake and collect urine sample for 10 hours and measure the amount of PABA excreted, okay. And day 1 and day 2 is completed, and the next one is the formula. The formula is also same. Instead of fluorescein dilaurate, so instead of fluorescein excreted on day 1, we are going to use the molecule PABA, okay. In the place of fluorescein, just replace fluorescein with the PABA. Para-aminobenzoic acid excreted on day 1, okay, that is the test 1, divided by para-aminobenzoic acid excreted on day 2, okay, that is the control, multiplied by 100 is equal to T by C index, okay. This T by C index, both, okay, this is same for same reference value for maybe this is a fluorescein dilaurate and also PABA test, okay. The normal pancreatic function, just now I said, we discussed, okay, T by C index is 30. If it is 30, the upper range, and 20 is the minimal range. And the pancreatic insufficiency, T by C is 20 or less, okay, that indicates the pancreatic insufficiency, okay. So with this, so we can conclude all the very important tests, both invasive and non-invasive, and non-invasive is very important when compared to invasive test. And we have some other components also that has to be studied by the students, because you should know, okay, what are the previous tests conducted by the clinical labs. So before maybe the discovering the concept of the PABA and fluorescein dilaurate. The other conventional and older methods are the fecal chymotrypsin estimation and fecal elastase 1 estimation. Okay, that means we can collect the sample of the feces from the patients, and we can maybe form a suspension, and from that, okay, the filter everything, okay, in the cold buffer, and completely centrifuge, and again filter, okay, with Wattman number 1 filter paper, and without any maybe the solid particles. You have to get a the complete solution. Okay, that solution is that is the source, okay, for checking the activity of chymotrypsin. You know very well, okay, the chymotrypsin is a proteolytic enzyme, and you have to add the protein, and that protein has to be hydrolyzed into different fragments of protein that can be estimated by using the Lowry et al. Method or Bradford method. The fecal elastase one, so that is also the same type of estimation like chymotrypsin. So here elastase is also a form of enzyme, and this elastase estimation or assay is more complex when compared to chymotrypsin. So these are the two methods. The problem is here we have to collect the fecal sample and the processing of fecal sample, and you know that this is actually speaking enzyme assay. If it is an enzyme assay, the handling of enzymes are very sensitive. For example, if you are getting the fecal sample and keeping it for maybe in the room temperature for 2 hours, all the chymotrypsin activity will be lost. Okay, so we have to do it as early as possible, and we have to keep the sample in the cold condition. And maybe if you are doing some maybe the separation of chymotrypsin from the fecal sample, that you have to do a process of steps, a cascade, maybe like a cascade of steps. You have to do it, and finally you will get the clear solution of the fecal aspiration. Okay, that one is used for the chymotrypsin estimation. And sometimes if you are missing any step, okay, to keep within the ice bucket and not maintaining the cold standard, that means the chymotrypsin enzyme activity may be lost. The enzymes are very sensitive. Okay, if you are not providing the buffer condition, the enzyme activity will be lost, and if you are not providing the pH and temperature and the ionic strength also, the enzyme activity will be lost. So this is for your information, students, and these are the very old tests nowadays. Okay, we are not considering, okay, this and all. Okay, the best one is non-invasive, and in non-invasive we have two tests. Okay, number one is fluorescein dilorate, number two is PABA. Okay, in the invasive we have the measurement of total volume of pancreatic juice and determination of amount of concentration of bicarbonate, and determination of activities of pancreatic enzyme by using secretin as a inducer. So here secretin is the inducer. Either it is injected by maybe IV, that is intravenous administration, or otherwise a minor concentration can be exposed into the tissues of the duodenum. Okay, those who have more allergic response to secretin, so it may be directly injected to the duodenum area, the little concentration. Okay, so with this we can conclude the diagnostic test for exocrine functions of pancreas, both invasive and non-invasive test, and this is the formula and reference value. So you have to keep everything in your mind, okay, without maybe forgetting the formula or otherwise the reference value. The main objective of the clinical biochemist, you should know the values of the reference and standard values, upper reference level and lower reference level, LRV and URV. URV means upper reference level, LRV means lower reference level. So both you should remember. And what is the concentration? For example, if you are focusing about, okay, the glucose concentration of blood, maybe if you want to identify, okay, you have to give the value 80 milligram per deciliter. If you are not writing the value milligram per deciliter, that is no value at all. So that is totally wrong. So you should remember the number 80. At the same time, the milligram per deciliter, that is also very important. If you are changing, can you change, okay, milligram to grams per deciliter? So the person cannot live. Okay, that is a wrong value. So this may give the wrong picture to the doctors, the medical practitioners, to take some adverse steps, okay, based on your report. So sometimes, okay, that may be lethal to the patient also. So as a clinical biochemistry students, okay, if you are going to the industry, okay, that is the medical laboratory technology industry, that is the clinical laboratories and all, and you have to remember everything. Okay, and based on the experience and based on the practice, okay, you will remember, okay, this one. So next, coming to the another topic. So we have 5 more minutes. Okay, with this we can conclude this section of today's lecture in advanced clinical biochemistry. Next topic is maldigestion and malabsorption. So maldigestion and malabsorption. What is maldigestion and absorption is stopped completely. So that is, there is no digestion and there is no absorption. And in this case is more complicated one, and this is not acute and all. Okay, this may be chronic. Okay, in the acute stages, okay, will not maybe not occur, okay, in the patients with the pancreatitis and all. So if the pancreatitis is chronic, automatically the maldigestion is possible and malabsorption is also possible. The first one is you have to do the diagnostic test for maldigestion and malabsorption. So one is routine biochemical test, and you know very well, okay, routine biochemical test or okay, the creatinine, urea, bilirubin, okay, all the routine biochemical test, you know very well, okay, these are all the test, okay, called as routine biochemical test, and you have to do this one, okay, and this will give the clear picture of what is the function of liver and what is the function of kidney, and if any enzymes are abnormal, for example ALT and AST, GGT. So based on that we can come to the conclusion which organ is affected, okay, by doing the routine biochemical test. Number 2 is the test for abnormalities that may indicate the possibility of malabsorption, that is blood hemoglobin concentration and mean red cell volume and the serum concentration of folate, ferritin, calcium, albumin and alkaline phosphatase. So all these parameters like the blood hemoglobin concentration, if you are checking the hemoglobin level, so if it is lesser than 10, okay, in the female, okay, that means they are all called as, okay, anemic. This may be due to, okay, their the menstrual cycle, or otherwise that may be related to anemia. So there are so many different types of anemias are there, including sickle cell is also anemia. Sickle cell anemia is also possible. So we have to check what is the reason for that. Okay, the blood hemoglobin concentration. So due to that the maldigestion and malabsorption may be there. Okay, so maldigestion and malabsorption, it may create a complication of absorption of heme, that is Fe ion, and also the protein concentration, and also all the vitamins, okay, related to heme metabolism. So the blood heme, okay, may be disturbed only by maldigestion and malabsorption. Okay, and mean red cell volume, if the red cells are very less, that may be the indication of maldigestion and malabsorption. And the serum concentration of folate, the folic acid, that is, okay, very very important, okay, for the normal metabolism. And the ferritin, the carrier of heme, and the calcium ion, okay, and albumin and alkaline phosphatase. Okay, these are all the vital parameters, okay, needed, okay, for the normal functioning of the body. And if all these components are very less, that indicates it's the severity, okay, of maldigestion and malabsorption. Test for antibodies for celiac disease, another complication. Just now, okay, we had an session, okay, that is a class on celiac disease, okay, that is celiac pathology. Okay, so this is due to the gluten, okay, the complication, gluten hypersensitivity. So this has to be checked, because that is maybe one of the reason for maldigestion and malabsorption. And coming to the chronic diarrhea, so here we are going to have, okay, the n number of tests. The first one is the full blood count. Okay, this is called as not FBC. Is now the term is CBC, the complete blood count. The full for FBC, okay, it's very common. So FBC is very common in most of the European countries and other countries. Okay, if you are seeing any book, okay, this will be like this. But in the clinical labs, okay, they will use the terminology CBC, the complete blood count, that indicates what is the maybe lymphocytes, monocytes, basophils, all the blood cell counts. Okay, this is done by not manually. Okay, this is done by very simple method. Okay, that's called as flow cytometry. Within a fraction of seconds, okay, we'll get the values. Liver function test, all the liver function test enzymes, okay, has to be done. Calcium, vitamin B12, folate, Fe, thyroid function test. Thyroid function test means there are 3 tests are there. One is there is T3, T4, TSH. All the 3 has to be tested. And celiac serology, pancreatic function test, microbiological examination of feces and ileum aspirations for bacterial, parasitic, fungal toxin and viral infections. So, this chronic diarrhea, not only by the abnormalities of organs like liver or pancreas. So this may be due to some parasite. Okay, for example, Ascaris or Taenia solium. Okay, all the parasites, okay, may give a lot of complications, okay, in the absorption process. So this chronic diarrhea may be caused by shigellosis or Salmonella typhi, okay, and also the amoebiasis, So all these comes under, okay, the microbiological section. Okay, that is the microbiological part of the clinical lab. Okay, they will do, they will take the fecal sample, and they will do all the medical bacteriology and medical parasitology and medical virology also. Sometimes, okay, maybe that viral infection may cause the chronic diarrhea. So with this, we can complete all the areas related to pancreas, and today we had a thorough insight, okay, into what is pancreas and what are the functions, exocrine, endocrine function, and after that the pathology of pancreas, what are the reasons for the chronic chronic pancreatitis, and how to avoid this one, and what are the diagnostic tests involved. Okay, starting from CT scan and also endoscopy, and next to the come to the clinical biochemistry labs. In the clinical biochemistry lab we have two, okay, that is invasive and non-invasive. In the invasive test, okay, we have the different types of determinations, and non-invasive, okay, just we can do either this test, okay, this fluorescein dilaurate test, if you have fluorimetry, that is more sensitive than colorimetry. And second one is the PABA test, okay, that is very useful for the colorimetry, so if you have colorimeter or spectrophotometer. So next, we had an idea about maldigestion, malabsorption, and finally chronic diarrhea. So all the areas are covered. Okay, now we completed the chapter of pancreas, and maybe we are going to the next chapter, okay, that is liver, because we are still in the digestive system. Okay, this the clinical chemistry based assessment of digestive system disorders. So we have the major organ, okay, the liver, and we are going to see in the next class. Okay, thank you for your support, and now the session is open for the questions.